How to treat and cure breast cancer. Breast cancer treatments are getting better all the time, and people have many more options today than ever before. With so many choices, it's a good idea to learn as much as you can about the ones that can help you the most. No matter which ones you choose, all breast cancer treatments have two main goals: to rid the body of as much of the cancer as possible, to prevent the disease from coming back. Your doctor will think about a few things before she recommends a treatment for you. The type of breast cancer you have, the size of your tumor, and how far the cancer has spread in your body, called the stage of your disease. If your tumor has things called receptors for HER2 protein, estrogen, and progesterone, or other specific features. Your age, if you've gone through menopause, other health conditions you have, and your personal preferences also play a role in this decision-making process. Some treatments remove or destroy the disease within the breast and nearby tissues, such as lymph nodes. These include surgery to remove the whole breast, called a mastectomy, or to remove just the tumor and tissues around it, called a lumpectomy or breast-conserving surgery. There are different types of mastectomies and lumpectomies. Radiation therapy, which uses high-energy waves to kill cancer cells. Other treatments destroy or control cancer cells all over the body. Chemotherapy uses drugs to kill cancer cells. As these powerful medicines fight the disease, they also can cause side effects, like nausea, hair loss, early menopause, hot flashes, and fatigue. Hormone therapy uses drugs to prevent hormones, especially estrogen, from fueling the growth of breast cancer cells. You might get chemotherapy, hormone therapy, or targeted therapy along with surgery or radiation. They can kill any cancer cells that were left behind by other treatments. Radiotherapy. Radiotherapy is a treatment involving the use of high-energy radiation. It's commonly used to treat cancer. Almost half of all people with cancer have radiotherapy as part of their treatment plan. Radiotherapy is also sometimes used to treat benign, non-cancerous, tumors and other conditions, such as thyroid disease and some blood disorders. This information focuses mainly on the use of radiotherapy as a treatment for cancer. Radiotherapy can be used, alone or in combination with chemotherapy, chemoradiotherapy, to try to cure cancers. For people with incurable cancers, radiotherapy is a very effective way of controlling symptoms. Radiotherapy can also be used before surgery to shrink a tumor so it's easier to remove, known as neoadjuvant treatment, or after surgery to destroy small amounts of tumor that may be left, known as adjuvant treatment. Chemotherapy. Chemotherapy is a type of cancer treatment, with medicine used to kill cancer cells. It kills the cancer cells by damaging them, so they can't reproduce and spread. Chemotherapy is used if a cancer has spread or if there's a risk that it will. The main aim of treatment may be to try to cure cancer completely. This is known as curative chemotherapy. To help make other treatments more effective, for example, chemotherapy can be combined with radiotherapy, where radiation is used to kill cancerous cells, or it can be used before surgery. To reduce the risk of the cancer returning after radiotherapy or surgery. To relieve symptoms, a cure may not be possible for advanced cancer, but chemotherapy may be used to relieve the symptoms and slow it down. This is known as palliative chemotherapy. Less commonly, chemotherapy is used to treat non-cancerous conditions. For example, low doses have been used to treat lupus and rheumatoid arthritis. There are many different types of chemotherapy medication, but they all work in much the same way. Depending on the type of cancer you have, you may be treated with one medicine, monotherapy, or with a combination of medicines, combination therapy. There are several ways in which chemotherapy medication can be given, including tablets and injections directly into a vein. The team caring for you will help come up with a treatment plan for your specific circumstances. Although there are some typical breast cancer treatment regimens, women do have choices. Talk with your doctor about all the risks and benefits of each treatment option and how they will affect your lifestyle. Think about joining a support group. Other people with breast cancer know what you're going through and can give you advice and understanding. They might help you decide on a treatment, too. Ask your doctor if you should join a clinical trial, a research study that tests new treatments before they're available to everyone.